The greatest day of my life was when I became a mother to my first son, and the second greatest day of my life was when I became a mother to my second son. This is a story of our son Matthew Garcia, which was born with the rare disease of the large intestines called Hirschsprung disease. Matthew actually was sent home from the hospital as soon as he was born. On about the 8th day, we knew that something was wrong. He had difficulty allowing his stew to go through his body like a normal child. Right away we would go to the ER or go to the urgent care, go to his doctor for normal exams, and they told me change his diet, change his formula, change his way of eating. Matthew was a breastfed baby, and the doctor even would tell me, maybe it was something in your diet that would affect him going to the restroom. Finally, after hearing so many different doctors and their opinions, and one day when Matthew was about 2 years old, I sat at my desk at work for about a 7-hour period looking for a gastroenterologist in that which worked with pediatrics. There was nobody in our area that worked with children with this. So finally we found a awesome team at UCLA Medical Center. It took me 2 phone calls to get to an appointment. When Matthew was 2.5, we saw the GI specialist about 3 months prior to that phone call. There was actually a 3-month waiting period to see Dr. Martin at UCLA. He was part of the gastroenterology team. Within the first visit, we actually were ordered a couple different major diagnostic tests that eventually ruled him out for Hirschsprung disease. When Matthew turned 3, about 6 months after that, he was scheduled for a common procedure to cut out the disease. It was called a pull-through procedure. That actually led him in the hospital. It was supposed to be an initial 5-day visit. 5 days actually turned into almost 4 months. Matthew's case actually was known to the surgical team there and also the gastroenterology team to be very rare. The biggest misconception of Matthew and his battle with Hirschsprung disease is that it's okay for this 4-year-old to just have an accident in his pants. But it's not. He's been battling this for 3 years. He's 7 now, and he doesn't want to battle with having to just go to the restroom and not able to allow his head to say, okay, it's time to go to the restroom now. But we are hopeful and we're grateful that we found a doctor in Cincinnati that is going to look at him and try to figure out the best medical plan for him, if it's going to be a bowel treatment or if it's going to be his last surgery. We're hopeful and we're thankful that he's going to look at his case. Dr. Pena in Cincinnati is very world-renowned for his treatments. He's actually the person that created the pull-through procedure back in the 70s, I believe. But we're very proud and hopeful that this is going to be his last round of treatment, and we'd like to thank all of our friends and family for praying for Matthew and sticking by him and walking him through this battle of Hirschsprung disease. And we are grateful for our Lord, and thank you for everybody for keeping us in your prayers.